In this real world use case segment, I'm looking for a healthcare blockchain technology that's based on a sound concept to implement and solve real inherent problems that exist within the healthcare industry. Hi, this is Jeff with the HODL Report. Join me as I explore part 2 of healthcare on the blockchain. Before I begin, I do need to read a brief disclaimer. I'm not a financial advisor, and any information that I provide is strictly based on my opinions. If I'm going to provide you with any advice, then let it be this: do your own research, invest only what you can afford to lose, invest only what you believe in, and don't buy or sell based on FUD or FOMO that's spread online. So with that, let's get started into today's topic on healthcare on the blockchain. So healthcare is an industry with a number of identifiable flaws. One of the most glaring issues is patient data management, or the lack thereof. Patients truly have no control over their own data, their own information, and the information that is out there is held hostage by each individual provider that the patient sees, whether it's a physician's office, hospital, imaging center. I discussed that on part 1. But this information is it's truly difficult to move from provider to provider. Within the current system, patients pay out dearly for their sick care and stay sick, and even more is paid out for healthy care. There's really no system in place for patients to be compensated for staying healthy and not going to the doctor. Beyond the patient data issue, there are inherent issues with the lack of transparency in the pharmaceutical industry and no real mechanism to monitor patient interaction with a pharmaceutical, and no documentation of these outcomes, whether positive or negative. Now, I've read through about a dozen or so companies. So far, I've only found maybe 2 or 3 that seem to have merit. By companies, I mean those companies that are seeking to put together a blockchain solution for healthcare. Now, there might not be an all-in-one solution, which is, I'm looking for one that has most of the solution, but at the very least, the company should pin their technology to an ecosystem that can manage app development as well as payment protocol, as well as being a data management solution. Now, the system must be able to manage a significant number of transactions per second, and has to have a robust mechanism for data tracking and a way to interface with other web content providers for image file storage solutions. So I don't expect that there's going to be a blockchain solution, an all-encompassing, that will also have a storage solution on its own. So there are companies out there like the Coin that's creating a decentralized mechanism for secure storage. So I'd expect that whatever solution is created might partner with one that is already in the stages of real world usage. So I think that would be very important. Now, transactions need to be quick. They have to be secure beyond the requirements of HIPAA. That's here in the US. So HIPAA stands for the Health Insurance Portability and Accountability Act, which is a U.S. law designed to provide privacy standards to protect patient rights, to protect patients' medical records and other health information provided to health plans, doctors, hospitals, and other healthcare providers. Now, if payouts are going to go to a patient and providers, the system should be digital asset agnostic, meaning that you should be able to use different digital assets on the ledger or different ledger digital assets and be able to handle micro payments. So the reach for this really needs to be global. It can't be in a microcosm of one state, one country. It might start there, but it really needs to spread beyond borders, and part of the solution, as I'll talk about, has to definitely have global reach so you can reach out to physician specialists. But this solution, this ecosystem, really needs to have a history of developing international networks. That's definitely a huge plus. There are a few options that you might already be thinking about. I'm sure there's others out there that are much more knowledgeable in this technical functionality of the blockchain space than I am. But after the video that I made the other day and all the research that I did going into that to kind of compile and organize that, I do believe that the Ripple ecosystem implementing Codius, Coil, the Interledger, and XRP would truly be the best foundation to build this blockchain healthcare network on. From a technology perspective, I have really been looking for a solution that can provide a real-world workable solution that will give patients control over their own healthcare data, accessible whenever and wherever they need it, meaning that if you're traveling, if you go to a different doctor, it doesn't matter where you are, you have access to your patient records, patient data, diagnoses, whatever it might be. You can easily hand that to the physician, and you don't have to fill out any more information and guesswork and maybe answer some questions, not others, but the physician can quickly look and make a determination based on previous health condition what your current ailment might be a result of. Patient records and medical testing data is currently not accessible beyond the provider, as I just mentioned, meaning the physician, the imaging center, or the hospital. So this is very important. Data that can be easily shared, again, by the patients with their doctors anywhere in the world if you're able to manage it in a blockchain ledger environment. Real-time tracking of patient prescriptions that are prescribed is also a valid concern. Who prescribed them? When did they prescribe them? Why did they prescribe them? What are the contraindications? What are the cross-interactions with any of the other drugs that the patient might be taking? This information should be available to the patients, to their doctors, and to the pharmacists. Right now, it's really not available to anybody because you could go to 3 different doctors and each of the 3 doctors have no idea what you're taking unless you told them, and the pharmacist doesn't know if you went to a different pharmacy. So it could definitely limit some problems that are caused, and there's definitely a lot of complications that arise due to cross-interaction between drugs. Transparent real-time tracking data for the care received and payments processed in hospitals and physician offices. So it's also important to cut down on fraud, or at least have some transparency and visibility of what you're being charged for. If you go into the doctor for X, you should be charged for X. You shouldn't be charged for X, Y, and Z, which does happen with the current system. Access to physician networks worldwide, I think, is critical. This can be done via telemedicine and video conference. Access to a specialist, so it would be a patient you have an ailment, you know that there's a specialist, let's say in Germany, and you live in the US, but really getting in front of that doctor in Germany is almost impossible today, first of all, to find them. But in this global network of physicians, it would be a lot easier to identify who the specialist would be, and then to schedule a meeting with them or an appointment with them via telemedicine or video conference. Then you would have direct access now to specialists anywhere, and again, you're not limited by your borders. Payment solutions to open the healthcare network globally to those of means and those with no means is important. So definitely a method of sponsorship from a blockchain company through a donor company or advertising company to financially support those without means, I think, is very important, because as you're providing something of financial benefit, it's good to give in return, and there are significant numbers of people around the world that have no means to go to these adequate specialists, and now it's a lot easier. There's no travel, there's no locked in specific getting from point A to point B, whether it's via car, plane, or whatever it might be. But if you can get on the computer, you can set up nursing stations, so there might be hardware scenarios involved. Like, let's say in India, for instance, there's a lot of outreach into the rural communities where they bring nurses and computers. They have a telemedicine already that's set up in India that's very functional. But here we're talking about putting it into the blockchain for more of a tracking mechanism and transparency, and building it into the entire ecosystem of this new healthcare network, a mechanism to be in place that a patient can decide when their demographic data is sold to, let's say, pharmaceutical companies or really any other company in this space. There should be some financial benefit from it. And I mentioned this in my previous video, but let's say you're sitting in front of your computer, an ad pops up. You're sitting in front of the TV, an ad pops up. Whatever it might be, in any environment, you're driving down the road, an ad pops up. But if we're going to interact and a doctor is going to prescribe a pharmaceutical to us, but we're opening up our patient demographics in some way to these pharmaceutical companies so they know that they're marketing to the right area, then there should be some form of monetization built in. Now, another component of this is medical equipment service tracking. This is really important, and this should happen for the life cycle of the equipment, meaning from production to end of life. You really need to know your equipment, whether you're the provider or the patient. You need to know the equipment that you're being tested on. Does this equipment meet the standard of care? So too many doctors out there are using outdated equipment that simply doesn't provide the standard of care in imaging that's expected and readily available with newer technology. Many patients can actually be misdiagnosed with or without a medical issue, meaning you're diagnosed with the issue or you're diagnosed without it, or the misdiagnosis completely, they miss the issue that you have simply due to the poor quality of the medical device. And there needs to be a measurable, documented, and transparent standard to monitor this. Now, one other component is a global rating system. So right now, you think about it, if you're unhappy with the doctor because he said the wrong thing, someone goes on Google, gives them 1 star, and it's extremely difficult for anyone to get rid of that negative feedback or comment on Google. Obviously, if it's put into a ledger system, it's also impossible to get it off. However, if you put a measurable and transparent protocol that will automatically track for positive and negative outcomes from a provider, so this form of transparency will truly hold providers accountable for the service that they're providing. But an automated AI rating system won't rely on random patient negative comments being left on a Google site merely because the doctor didn't say hello. And so there could be a mechanism put in place where this is automated based on certain criteria that's met, a follow-up questionnaire or whatever. There has to be some form of measurable, and then as it collects, this AI or the automated system is then collecting the data inputs from all the patients, and from that you can generate a rating system. It could be patient outcomes. If the patient recovered, didn't recover, the patient was still sick, they had to come back for multiple visits. So there's different measurables that could be put in place that could automate this rating system. Patients who take care of themselves could receive some form of monetization from large providers or marketing conglomerates instead of being bombarded by ads. As I had mentioned, monetization of a patient's health to benefit the patient is a way to help hold the patient accountable for their own well-being. Now, transparency in the pharmaceutical industry to track the viability of the pharmaceuticals based on real-time measure of patient outcomes, tracked not from the small trial sample studies that they normally do, but ongoing metrics based on real-time usage. So drugs are put in the market, we see it all the time on TV, that turn into lawsuits because X number of people die due to the pharmaceutical, mainly because they really didn't go through the right testing, or they didn't truly test for the interaction with other drugs, or they have all these different side effects. So if these measurables, again, are tracked in a transparent manner that can be documented, you can show the actual stats for positive and or negative outcomes, which could also assist from a legal perspective to simplify the legal outcome of a case like that. So everything would be transparent during the production phase as well, in terms of the trial outcomes going into actual production. So right now a lot of things can be covered up, whether it's by government agency or by the pharmaceutical companies themselves. Now, with all of this that I'm talking about, and I've been, again, reading through dozens of these companies online trying to find a solution to see if there's anybody out there, and I've stumbled across a few. I've seen little bits and fragments of what I'm talking about, and I drafted this out months ago. Of these companies that seem to have a solution, though, what's interesting is that many of them seem to be building their plan based on a solution like Ethereum. One was basing it on EOS, and I'm not really sure if these other solutions are going to provide a robust enough ecosystem that's going to be required for a global rollout of this healthcare solution. Maybe if it's limited to a small geographic setting, but as the demands increase on this solution, whether it's from the transactions of data, the number of patients, so you're going to meet a specific threshold at some point, and data is one of the most difficult issues to deal with right now, which is patient data and imaging storage is by far, one of the largest and growing aspects of business and one of the most competitive spaces, but it's extremely, extremely difficult due to the non-compliance of the different programs, the different data storage sites of communicating with each other. Which makes it really difficult. You have a lot of proprietary softwares, but you need to find a solution of one blockchain type solution that can then interface through an API with the Interledger or via other web solutions, so you can have the payment structure, you can have information sharing. There's a lot of things that need to happen, and you need a robust ecosystem to facilitate that. So I mentioned at the beginning, I believe it could be the Ripple ecosystem with Codius, Coil, the Interledger, and XRP. I believe that all together, these are providing the right solution to build something like this. If we see that Ripple is building the ecosystem for cross-border payments, which is significant, and there's a lot of communication and messaging and payments that need to take place. The same thing with healthcare. It's as important, if not more important, that the transactions are managed in a proper way, and you can't just rely on an ecosystem that you build on that won't be able to handle or manage it. So this is my opinion, and again, selecting the right platform and ecosystem to build a foundation for developing this revolutionary healthcare solution is so extremely important. Now, I'd love your feedback. I'd love your comments. I'm sure there's a lot of opinions on this, on the right ecosystem to use. I'm sure from the XRP community, I'll get some real positive feedback. If you know of any other companies out there that maybe I haven't looked at yet, you can shoot them over to me. If you think of any other solutions to add to this, I'd love to hear your feedback on that. And if you enjoyed today's video, please give a thumbs up, like the video, subscribe to the channel. If you do subscribe and you want auto notifier, hit the bell next to the subscribe. And with that, I definitely look forward to seeing you on my next video, and keep on hodling your crypto.